Hi, my name is Michael McElroy.
And I'm Kyle Scher. We're certified and licensed athletic trainers who work here in clinic at the Children's Hospital Wisconsin Sports Medicine Program. It's our job to provide support to the physicians who work here in clinic as part of your child's visit.
Today we're going to talk a little bit more about common injuries such as sprains and strains that can happen to your child during sports and athletic activities. What I have here is a model of the knee. If we look here, this illustrates a tendon which comes down and attaches to the shin bone. Injury to this would be classified as a strain. On the other side, however, this is an illustration of a ligament which connects bone to bone. Injury to this would be classified as a sprain. Sprains and strains are classified into three categories. Grade 1 is an overstretching of the ligament or tissue. Think of this as a rope that is starting to become frayed. A grade 2 injury is different in that it involves more of a stretching and partial tearing of the structure. And then finally, grade 3 would be a complete rupture or complete tear of the structure. It's important to understand that sprains or strains can be the result of one specific injury, or it can be the result of overuse. If you suspect that your son or daughter has suffered a sprain or strain, it's important to initially treat the injury with rest, ice, compression, and elevation.
When sprains and strains occur, it's the body's natural reaction to limit range of motion and strength. This is to help prevent further injury. With this in mind, rehabilitation and therapy early after an injury is geared at restoring full range of motion, and then following that, working back into strengthening exercises to help prepare athletes not only for everyday life, but working back into the sports and activities that they enjoy. To illustrate some of the types of exercises that help restore range of motion and strength, today we're going to take a look at common exercises that are used in the rehabilitation of the foot and ankle joint. As this is one of the most commonly injured locations that we see here in clinic, this will be a good example of types of exercises that you can do to not only help rehabilitate injuries, but also to help prevent them. Examples of these types of exercises are typically geared at range of motion and strength. And one example of this would be an exercise called ABCs. So for example, what I would do is ask Mike to imagine that he had a pen stuck in between his toes and that he is writing his ABCs, working through the alphabet. Imagine if there's a sheet of paper in front of him that he's writing on. This helps to restore range of motion to the foot and ankle. A second type of range of motion exercise that we provide here in clinic would be a basic calf stretch. In this example, I'm going to have Mike lean against the wall with his injured ankle behind him. He's going to keep his legs straight and essentially stretch his calf muscles. Again, these are just a few examples of the types of exercises that we would provide here in clinic to help restore range of motion. Today we covered both what a sprain and strain is, and also some basic exercises that are involved in the care of your child's injury if one of these injuries does occur. It's important to remember that each child's injury is individual, and therefore a customized program is often necessary to return your child to safe sport and physical activity.
It's also important to understand that if symptoms don't improve, referral to a sports medicine specialist may be necessary.
For more information, check out our website at chw.org/sportsmedicine.
You can also like us on Facebook.